Hello doctor, so welcome to Raptorial, and ayun, since we are just about to start our review lessons, so I will introduce myself again. So my name is Dr. Rafael Roma. You can call me Doc Rap for short. And our first topic would be, it's going to be our favorite subject, which is general anatomy. So, as we all know, yung general anatomy, we actually, meron tayong dalawang general anatomy, di ba? The general anatomy ng thoracic region, tsaka ng abdominal region, pababa. And GA2, we have the general anatomy of the head and neck. So, 1 year nating inaral tong general anatomy during our first year proper. So, imagine, first year proper pa natin ito inaral. So, talagang most of the topics dito ay nakalimutan na natin. Yun yung mga inaral lang natin para makapasa tayo ng exam or yun, mga quizzes hanggang makapasa tayo ng subject. But, some of them, yun, dahil sa dami nating inaaral nga naman, di ba, na subjects, so nakalimutan na natin siya. But then, once na maituro siya ulit sa review, more on recall lang siya eh. Kapag medyo na-refresh siya, maalala nyo, ay oo nga no, naalala ko siya. Ganun. Okay? So, we will be starting with general anatomy dahil ito yung basics. Okay? So, if you know a lot about general anatomy, then medyo mas madali for you yung other subjects like general pathology or kung oral pathology man yan or any other subjects like surgery or prosto. Kasi we are well aware of the fundamentals. Okay? Yung normal na dapat makita natin sa ating body. Okay? So we have general anatomy review and we will be starting off with the anatomical terms. Okay? So review muna tayo. So we have three major anatomical planes. We have sagittal, coronal, and horizontal. And as you can see dyan sa photo, ayan, divided siya para maging 3D. So, kapag tinanong tayo, which among the following anatomical planes divide the body into right and left halves, what would be the correct answer? Right and left halves. So, meaning we have right, tsaka left. So, what is that anatomical plane? Is that sagittal, coronal, or horizontal? Correct answer would be, it would be sagittal. Okay? Again, divides the body into right and left halves. Okay? How about if tanongin naman tayo, what divides the body into anterior and posterior halves? So, meron tayong anterior, harapan, and we have posterior. So, what is this anatomical plane naman? So, we only have two left. So, is it coronal or horizontal? Coronal or horizontal? Correct answer for that would be para siyang corona. Okay? So, it's coronal. Again, divides the body into anterior and posterior halves. Then, lastly, kapag horizontal naman, ano naman yung kailangan natin malaman? So, pag sinabi natin horizontal, it divides the body into what? Superior and inferior halves. Again, horizontal divides the body into superior and inferior halves. Anyway, I forgot to remind everybody na since ang general anatomy is a subject that we took during first year proper, basta general sciences during the first and second year proper, yung mga subjects na yan, I usually ask the students to write. Why? Kasi pag sinusulat ng estudyante, mas better yung recall for them. Kasi imagine, you are hearing, di ba? You are watching a video. So, you are hearing kung ano man yung sinasabi ko. So, that's auditory. Tapos, we also have visual kasi nakikita mo yung sinusulat mo. And lastly, it's also kinesthetic kasi you are doing something with your hands. So, you are applying all those three, yung writing, yung kinesthetic, yung visual, and also yung auditory. So, better yung recall, especially nga, medyo matagal na tong mga subjects na to. So, have a pen and paper ready kapag general sciences. So, all the GA, we really have to write. Okay? Alam kong gusto natin ng handouts, pero kahit naman ako from before, kapag may handouts, di ba, parang photocopy naman, di ba? O kaya yung classmate mong maganda yung sulat, pwedeng pa photocopy, ganon. Pero yun, I found out na yun, kahit sobrang pangit ng sulat ko, pag ako yung nagsulat, mas better yung recall for me. And I want that for you as well, yung better recall, since we are trying to remember this subject. Okay? So again, we have three planes: sagittal, coronal, horizontal. Sagittal divides the body into right and left halves. The coronal divides the body into anterior and posterior halves. And we have horizontal, which divides the body into superior and inferior halves. So, pag ganyan siya. Horizontal nga naman, di ba? Horizon. How about if tanungin ka, what divides the body into right and left equal halves? Meron tayong right and left halves. Pero, nagkaroon tayo ng word na equal. Diyan na pumapasok yung term na mid-sagittal. Okay? Kasi equal siya, so hinati mo siya sa midline. Basta nakita nyo yung word na equal, it's more of the mid-sagittal. Kasi there was a board exam question before na yun, ang tanong was, what divides the body into right and left equal halves? And we have sagittal, coronal, horizontal, and mid-sagittal. So, pag nakita niyo yung term na equal, yes, it's sagittal, but mas accurate yung mid-sagittal. So, correct answer for that would be mid-sagittal. Okay? Then, question. Sa human body, if you say dorsal portion, does it always say na okay, does it always mean na kapag dorsal, posterior, and back, synonymous sila? And also kapag sinabi mong ventral, anterior, or in front, synonymous ba sila? Again, we have dorsal, posterior, and back. Dorsal, posterior, and back. We also have ventral, anterior, tsaka front. Synonymous ba siya? Okay. Correct answer is no. Okay? Kasi when it comes to animals, it is the other way around, especially doon sa mga animals who are walking on all fours. Okay, like mga dogs, cats, mga lions, 'di ba? They are all using yung lahat ng limbs nila. So it is the other way around for animals. However, if we are talking about human anatomy, it is always synonymous. Okay, again, if we are talking about human general anatomy, this is always synonymous. The dorsal, posterior, and back. ventral anterior front. Same lang sila. Okay? So, next. What are the other terms na kailangan nating maalala? Okay, so recall lang to ha. So, wait. Erase ko na to. Okay, ano pa yung nakikita nating mga terms diyan sa picture natin? So, we also have proximal and distal. What's the difference between proximal versus distal? Kapag sinabi nating proximal, ang point of reference natin is actually yung root of the limb or the origin. Okay? Kasi kapag sinabi mong proximal distal, you can only use this for the GIT, gastrointestinal tract, and also the extremities. Okay. Again, ang origin for the GIT is what? Or ang point of reference for the GIT is the origin or kung saan siya nagsisimula. And saan ba nagsisimula ang GIT? It starts with the oral cavity. Diba? Oral cavity, and it goes in. We will further discuss about this during the gastrointestinal system. Okay? So, we have what we call the alimentary canal. And ang origin niya is the oral cavity, ang end is the anus. Okay? So, kung sino yung mas malapit sa origin, which is the oral cavity, then siya yung proximal. Okay? So, for example, sabihin natin na small intestine versus the stomach. Okay? We can say na stomach is proximal to the intestine. Okay? So, ibig sabihin, mas malapit yung stomach sa origin compared to the intestine. Whether small intestine ba yan or large intestine. Then, we can also use this sa mga extremities. So, as you can see there sa photo, we can say na the ulna is distal to the humerus. Okay? So, kung sino yung mas malapit sa root of the limb, and the root of the limb is here. Sino mas malapit? Si humerus ba? Or si ulna? Si humerus. So, the humerus is proximal compared to the ulna. Okay, so that's an example. Proximal versus distal. What else? How about lateral and medial? Okay, lateral and medial. As you can see there sa photo, lateral, medial, lateral. Ano naman yung point of reference natin? Lateral versus medial. What's the point of reference for that? The point of reference for this naman is what? The midline or the middle portion. Okay? So kapag sinabi nating medial, siya yung closer sa midline. Proximal is farther doon sa midline. Okay? What else? Ayan, we also have inferior and superior. So, based lang to sa orientation. So, if you know yung tamang anatomy ng body natin, so you can say na the heart is superior compared to the diaphragm. Okay? So, that's an example. Kung sino yung mas mataas, superior. Sino mas mababa? Siya yung inferior. Okay? Now, let's go to the body cavity. Okay? Body cavity. Ito yung mga body cavity natin. Pag sinabi natin cavity, we are referring to, diba? Pag sinabing cavity, it means space or or something hollow. So, body cavity. So, body cavity. And itong mga body cavity na to, hindi siya basta hollow lang, yung space lang. Okay? Itong mga body cavities natin is actually meron siyang lining. Okay? Meron siyang lining. And itong lining na to, we also call it the serosa. Okay? That's the lining epithelium. And meron tayong dalawang klase ng lining or serosa. We have, ito, naalala pa? We have visceral. And number 2, ano yung isa pa? We have parietal. Okay. Visceral and parietal. One of this, it is actually referring to the lining. It lines the organ. What do we, alin siya dyan? Visceral or parietal? Which among the following serosa lines the organ? Kumbaga, may isang malapit sa organ, may isang malapit doon sa wall nung cavity na to. Yung malapit sa organ is the visceral. This one lines the organ. One way para maalala mo siya is yun. Kumakain kayo ng mga lamang loob, mga barbecue. Hindi yung barbecue na meat ha. Yung, di ba kumakain kayo ng isaw or yung isaw baboy, yung bilog. Ayan. So, minsan try mo kapag bumili ka ng ganun sa labas, ng isaw, ganyan. Manong, pabili nga ng viscera. So, para hindi mo siya makalimutan na viscera is referring to the internal organs. Okay? Viscera, organs. Viscera, organs. Then, we are left with the parietal epithelium. So, this one naman lines the wall. So, the parietal lines the wall of the body cavity. Okay? Then, itong mga body cavities na to, may kanya-kanyang tawag dito sa mga body cavities na to. Depende kung saan sila located. As you can see, meron tayong 3 major body cavities. We have here, sa thoracic region, meron tayong body cavity for the lungs. We also have a body cavity for the heart. And we also have a body cavity for the whole abdomen. Okay? And what do we call these cavities? So, meron tayo for the heart. We have one for the lungs. And we also have one for the abdomen. And what do we call these body cavities? May kanya-kanya silang pangalan. So, for the heart, we call it the pericardium. Okay? Pericardium ang tawag sa body cavity of the heart. How about for the lungs? For the lungs, we call it the pleura. Okay? So, kapag narinig mo pleural effusion, it is referring to the lungs. Okay? Then, how about the abdomen? For the abdomen, we call it the peritoneum. Okay? Or peritoneal cavity. Diba? So, we have the heart, pericardium, the lungs, pleura, and the abdomen is called peritoneum. Okay? Then, in between pala nito, meron tayong space in between the serous and the visceral. Meron tong fluid, and bakit merong fluid in between them? Okay? So again, meron tayong space in between ng netong serosa and also nung viscera. Okay. So viscera is the one lining the organ. And yung serosa, we are pertaining to yung pinaka-lining dito sa wall area. Okay? And meron daw siyang fluid in between them. And anong source or anong purpose bakit merong fluid in between them? So yung space in between them, it actually contains fluid para what? To decrease yung friction in between the visceral and the parietal or the serosa. So it decreases the friction kasi nga naman kung nagkikis-kisan silang dalawa, 'di ba? It creates friction. Okay? And hindi natin gusto 'yan kasi it will create complications. And also sa patho, ito pala, during anatomy, we will be, kumbaga meron akong mga ipapasok na topics from time to time, like patho, pharma, anes. Okay, huwag kayong magugulat na parang, hala, pang general anatomy lang yung preparedness ko mentally. Well, ganyan din ako dati. Okay, so I can feel you. Na parang pag biglang nag-insert, parang, ano ba naman to? Anatomy lang yung usapan. Pero, very helpful siya. Kasi, dun mo makikita yung connection ng anatomy with the other subjects. And by the end ng review, talagang kumbaga, mako-connect the dots mo sila. Okay? So, mai-integrate mo lahat ng subjects na they are all connected to each other. And that would be better. Okay? So insert tayo ng konting patho. Kasi sa patho, in cases of inflammation, in cases of infection, in cases of malignancy, and in cases of injury, again, in cases of inflammation, infection, malignancy, and injury, nagkakaroon tayo ng increase doon sa fluid na tinutukoy natin. Okay? So, nagkakaroon tayo ng increase in fluid volume. And, kapag nagkaroon tayo ng increase in fluid volume, what do we call that condition? Okay? What do we call that condition? We call it edema. Okay, increase in fluid is termed as edema. Or in Tagalog, we call it manas. Diba? Yung mga nagbubuntis, nagmamanas yung mga extremities nila. Okay? And itong edema na to, merong kanya-kanyang tawag din yung edema na to, depende kung saan siya located. So, sabi ko nga, diba, may kanya-kanya silang pangalan. Heart, pericardium, lungs, pleura, abdomen, peritoneum. So, even itong edema na to, may kanya-kanya din silang pangalan. Okay? Depende kung saan siya makikita dito sa tatlong body cavities. So, first, sa heart, what do we call increase in fluid volume dyan sa heart area or dyan sa pericardium? We call it what? So, pericardium, it's called pericardial effusion. Okay? So, lagyan mo lang ng effusion. So, edema ng pericardium would be called pericardial effusion. Okay? How about lungs? What is edema sa pleural cavity. We call it, yun lang din. It's called pleural effusion. How about edema ng peritoneum or peritoneal cavity? What do we call that? Is it peritoneal effusion? No, wala tayong tinatawag na peritoneal effusion. We call it, what? It's called ascites. Okay? Ascites. Siya lang yung naiiba. Siya yung iba yung tawag. Ibig sabihin, increase in fluid sa abdominal cavity. Okay? Okay pa ba? Okay? Masyado bang mabilis? Of course, hindi niyo ako naririnig. Pero, yun lang. The first few subjects talaga, medyo mabagal ako mag-discuss. And paulit-ulit. Kasi, medyo wala pa tayo sa momentum since we just started. So, talagang kailangan talaga ng recall. That's why, kahit mainis ka na sa akin dahil paulit-ulit ako, well, kailangan nyo yan sa umpisa. Okay? Later on, pag medyo nakuha nyo na yung momentum nyo, then, pwede nating, kumbaga, medyo bilisan ng konti. Pero, syempre, to the point na naiintindihan pa rin natin yung subject. Okay? And usually pa. Ayun, sa first day, okay pa yung review. Pero, yun, after mga 4 hours, ganyan, sobrang lutang na. Especially kami, I reviewed with, actually under UP. And ang review namin starts at 8 a.m. Magla-lunch kami at 12 noon. Resume ng 1 p.m. And matatapos siya ng 5 p.m. So, good luck naman sa brain cells mo, di ba? Parang nag-self-suicide na yung brain cells mo dahil sa dami ng information. So, actually, maganda yung setup natin kasi pinuputol-putol natin siya for every subject. Okay? So, take advantage of that. And, recorded video siya. So, if meron kang medyo na-miss, medyo mo lang siya. I-rewind ng konti, di ba? So, ganon siya kadali. Okay? Then, as you can see, nandito pa rin tayo sa body cavities. So, etong pericardial or pericardium tsaka pleura, magkasama sila sa thoracic region. Then, we also have itong abdominal cavity. Nandito naman siya sa abdominal region. And meron tayo nakikitang structure in between the thoracic cavity and the abdominal cavity. And what would that be? Anong tawag dyan? This is actually a muscle. We call it gamit mo yan panghinga. We call it the diaphragm. Okay? Diaphragm. Tama, diaphragm. And itong diaphragm, ang natanong before was, is it a skeletal muscle or is it a smooth muscle? Skeletal muscle or smooth muscle? Ipaisip ko ngayon. Ano nga ba? Hindi ko rin alam. Yan. So, tinanong mo yung katabi mo yun. So, yan. Skeletal muscle or smooth muscle? Well, the correct answer is, well, it's very obvious naman. Okay. Very obvious naman. It is actually attached to a bone. Okay? And pag ang muscle attached to a bone, it is a skeletal muscle. Please remember that. Okay? And good luck naman. Good luck naman sa iyo kung ang diaphragm mo is a smooth muscle. Okay? So yun, it is actually a skeletal muscle. Kasi ang diaphragm is attached to the vertebra and also the anterior abdominal wall. Okay? So again, posteriorly, it is attached to the vertebra. Very long spelling. Vertebra. And anteriorly, it is attached to the anterior abdominal wall. Via what? Central tendon ang tawag doon. Central tendon. Di ba? What connects muscles and what connects muscle to bones? Di ba? We call it tendons. Okay? And what do we call kapag bones to bones? Bones to bones would be ligament. Review lang yan, okay? And as you can see as well, na ang diaphragm is paganyan siya. Okay? It is a dome-shaped organ. Okay? A dome-shaped muscle. And ang usual na pangalitong tanong was kapag nag-exhale ka, is it relaxing or is it contracting? Again, kapag nag-exhale ka, naglalabas ka ng hangin from your lungs, is it in a relaxed position or is it in a contracted position? So always remember ganyan ang diaphragm. Okay? So in times na nag-i-inspire ka or humihinga ka, nag-i-inhale ka ng air papaloob. So what happens is what? Ito yung relaxed position niya. Okay? So it contracts during inhalation. Then it relaxes again during exhalation. So okay? Ganon. So again, exhale. Remember na ang exhalation or pag-exhale is relax si diaphragm. And kapag nag-inhale naman is nagko-contract si diaphragm. Okay? So, kapag nag-exhale ka, for example, you are singing or you are actually speaking, di ba? You are exhaling during those times. So, it is in a relaxed position. Kapag contracted naman siya during inspiration, then you are contracting your diaphragm during inspiration or inhalation. And okay, meron tayong 3 main openings ng diaphragm. Hindi siya basta sheet of muscle lang na dome shape. Okay, meron siyang mga butas. And ano tong mga butas na to? Well, naka-enumerate na dyan. We have aortic opening, esophageal opening, and caval opening. Okay? So, meron tayong mga important points na kailangan matandaan when it comes to the 3 main openings of the diaphragm. So, 3 main openings of the diaphragm. So, what are they? So, para mas madali nyo siyang matandaan, we have actually a table. Isulat nyo siya this way. CEA. Okay. Then, always remember 8, 10, and 12. Okay. We'll be creating a table. CEA 8, 10, 12. And what does it stand for? So, C stands for the caval opening. Very obvious naman, di ba? Pag sinabi natin caval, anong dumadaan sa kanya? It is the inferior vena cava. Kaya nga caval opening. Then, E stands for the what? The esophageal opening. And very obvious naman, anong dumadaan sa kanya? The esophagus. And for the last one, the A is aortic opening. Anong dumadaan sa kanya? Aorta. Diba? Very self-explanatory naman siya. And what else do we have to know? So, CEA, caval, esophageal, aortic. 8, 10, 12. Ano naman ibig sabihin ng 8, 10, 12 na yan? So, it stands for the thoracic vertebra. Naka-level niya. So, kung thoracic siya, lagyan mo lang ng T sa umpisa. So, the caval opening is at the level of the T8, thoracic vertebra number 8. Esophageal opening, T10. Aortic opening, T12. Okay, CEA 8, 10, 12. Okay, para hindi tayo malito. And what else do we have to remember? We also have to know anong mga structures yung nagpa-pass through sa kanila. Well, sa caval opening, we already mentioned inferior vena cava. But what else? So, dyan din nagpa-pass through ang what? Phrenic nerve. What is the phrenic nerve? Phrenic nerve is actually what innervates the diaphragm. Okay? Ito yung nag-i-innervate sa diaphragm. Phrenic nerve. T8 level, and it is in the caval opening. For the esophageal opening naman, what other structures pass through besides yung esophagus? Ito, medyo madali lang. So, esophagus, vagus. Okay? Vagus nerve. So, pareha silang merong us sa pangalan. So, magkaano lang sila? Magkapatid. Okay? Magkatunog lang naman sila eh. And vagus nerve is actually the longest cranial nerve. It's cranial nerve number 10, as we all know. Okay, that's the vagus nerve. And lastly, we have the aortic opening. So besides the aorta, what other structure or structures pass through sa aortic opening? Ito naman, we have the azygos vein, and also the thoracic duct. Again, we have azygos vein and thoracic duct. So, review ulit tayo. CEA 8, 10, 12. We have phrenic nerve, vagus nerve, azygos vein, thoracic duct. Please take note that the thoracic duct is actually the largest lymphatic vessel. Okay, once again, please take note the thoracic duct is actually the largest lymphatic vessel. And ano ba yung dinedrain niya? Okay. Well, the thoracic duct actually drains the lower right region, and also the entire left side of the body. Again, lower right region of the body and the entire left side of the body. Kaya siya yung largest lymphatic vessel. Kasi tingnan mo, sobrang dami niyang dine-drain. Ang tanong mo, sino nagde-drain nung upper right. Okay? Ang nagda-drain naman ng upper right is actually the right lymphatic duct. Okay? Meron tayong tinatawag na right lymphatic duct. And this drains the upper right side of the body. Sorry, medyo tabingi ako. So, medyo gaganyan ka para mabasa mo siya. So, again, largest lymphatic vessel, ang thoracic duct. It drains the lower right and also the entire left side of the body. Okay? Sa, sa upper right side, it's the right lymphatic duct. Okay? Now, let's go to the abdominal contents. First of all, these abdominal contents, the abdomen can actually be divided into either, merong dalawang ways kung paano i-divide yung abdominal region natin. First of all is via use of what we call quadrants. Pag sinabi natin quadrants, quad meaning 4 only siya. Okay? So, and paano natin pinapangalanan yung quadrant? So, syempre meron tayong right upper quadrant. We have left upper quadrant. We have left lower quadrant and the right lower quadrant. So, ganyan yung division niya. And dito sa quadrant, so as we can see dito sa photo natin, so if we are going to draw itong nasa photo natin, pag tinanong ka, saan makikita ang liver? What's our answer? Right upper, left lower, or right lower? So our answer, ang usual answer natin would be right upper quadrant. But technically, ang liver actually occupies both the right upper quadrant as well may konting portions na nandito sa left upper quadrant. So that's how it goes for the liver. Then sino pa yung ibang structures na makikita natin dito sa right upper quadrant? Of course, sino ba yung nasa ilalim ng liver? Meron tayo ditong structure called the gallbladder. Okay. Kapag tinanong ka naman, saan makikita ang stomach? Ang usual answer natin would be left upper quadrant, as what we can see here sa photo. But, ganun ulit siya. Technically, ang stomach actually medyo passes through the midline. And some of it goes to the dito din, sa right upper quadrant. Okay? So, if tatanungin ka saan siya makikita, both right upper and left upper. Pero if ang tanong is majority, saan mo siya makikita, then your answer would be left upper quadrant because it deviates to the left side of the body. What else can we see dito sa left upper quadrant? Diba, meron tayong structure dito. We call it the spleen, which is actually hinahanap natin during our dissection from before. Then, after ng stomach, diba, it now goes to the small intestine, which is medyo nandito sa gitna. And then, so, medyo malaki yung, or mahaba yung small intestine. Then, how about, very common is, ang tanong is, saan nakikita yung appendix? Okay? Pag appendix, isa lang yan. We can only see it sa right lower quadrant. Okay? So, saan ba nagsa-start ang large intestine? Also on the right lower quadrant. So, dito mag-end yung small intestine. And then, meron tayong malaking descended portion. And then, it goes up. And then, it goes to the other side. And then, it goes down. Okay, ganyan yung itsura niya. And dito sa distended portion na to, what do we call this distended portion? We call it this distended portion is called the cecum. Okay, and dito sa cecum, dito natin makikita yung finger-like projection, which is the appendix. Okay, diba tatanungin ko ng iba, may appendix ka ba? Or na-appendix ka ba? Pero yun, lahat ng tao mayroong appendix, not unless mag-undergo sila ng surgery, which we call appendectomy, which is total removal ng appendix. Okay, so cecum is the distended portion, and dyan nagsisimula yung large intestine. And dito naman sa appendix, dito sa cecum natin makikita yung appendix. And yun nga, sinasabi nila na walang use daw ang appendix, pero technically it's part of the lymphatic system. So after ng appendix, it now goes upward. So what do we call this portion? It's called the ascending colon. And then it bends, nagiging perpendicular siya. We call it the transverse colon. And then it bends again and goes down. We call it the descending colon. And then meron tayong slight bending there called the sigmoid colon, rectum, and then anus. Yung last part of the heart. So this descending colon, we have transverse colon, we have descending colon. And what do we call pala itong bending nitong ascending colon para maging transverse colon siya? Well, itong bending na to, we actually call it a flexure. Kasi nga naman, nag-flex siya, di ba? Biglang gumilid. Okay? And since malapit siya sa liver, okay, we call it the what flexure? It's called the hepatic flexure. Since malapit siya sa liver. And then, how about this portion naman? From the transverse colon, then it bends going down to the descending colon. What do we call this flexure? It's also a flexure. Malapit naman siya sa spleen. So it's called the splenic flexure. Okay? Splenic flexure naman ang tawag dyan. Anyway, ang spleen pala, anong function ng spleen natin? Ang spleen, actually, what it does is, di ba, it filters or sequesters mga dead RBCs, di ba? As they call it sa anatomy book, it is the graveyard of the RBCs. So, for example, magkaroon ka ng mga pathology such as magkaroon ka ng hemolytic anemia. So, what happens during hemolytic anemia? So, you have anemia, kaya nga anemia. Then, nagkakaroon ng hemolysis. Ibig sabihin, nagkakaroon ng lysis or destruction ng RBCs mo. And kung ang daming nade-destroy na RBCs, lahat yan, pupunta yan sa spleen because it is the graveyard of the RBCs. And what happens, ano yung nagiging manifestation ng hemolytic anemia? Nagkakaroon siya ng splenomegaly. Lumalaki yung spleen. Why? Because there are a lot of RBCs na nade-destroy because of the hemolysis. Okay? And RBCs anyway, how long yung lifespan ng RBCs? Alam natin yan. It's 120 days. Pero kung tatanungin ka, how about platelets? Gano'ng katagal? Hindi ko po alam. So yun, nakakapagtaka lang, no? Kapag dentistry, tanungin mo, how long yung lifespan ng RBCs? Alam na alam. Sure na sure. 120 days. Pero pag tatanungin mo na, how about the WBCs, the platelets, medyo hindi na alam. Anyway, yung platelets, ang lifespan ng platelets is actually 7 to 10 days. Ang platelets natin. Ang lifespan. Okay? And anyway, for this, for dividing the abdominal region into quadrants, anong disadvantage niya? Diba kanina tinatanong ko kayo, paano kung tatanungin ka, where would you see the small intestine? Nasa gitna. Where would you see the transverse colon? Nasa gitna din. Where would you see the bladder? Nasa medyo likuran siya, retroperitoneal, di ba? Pero nasa gitna din. Di ba? Kapag ang gamit natin is quadrants, ang limitation niya is it doesn't respect yung mga midline structures kasi nga nalilimitahan siya. Tanungin ka, saan mo makikita yung reproductive organs, saan mo makikita yung anus, saan mo makikita yung rectum, lahat ang sagot mo, gitna. Okay, so hindi mo siya masyadong ma-divide using quadrants. So that's why na-invento talaga yun. Itong abdominal contents, dividing them into what we call regions. So meron tayong 4 quadrants, but we have 9 regions. Okay? And paano yung division nitong regions na to? Okay? So, i-draw ulit natin siya. So, we have 4 quadrants and we have 9 regions. So, parang magdodrawing ka lang ng tic-tac-toe. Okay? And sino tong nasa gitna? Itong nasa gitna, bakit merong ganyan? This is the umbilicus. Okay? This is the umbilicus. And itong umbilicus is, since dyan mo makikita yung umbilicus, then it's called the what? Umbilical region. As you can see here sa photo natin. Umbilical region. And anong makikita mong mga structures dyan? That's where you can see the jejunum. Parang jejunum and the ileum. Jejunum and the ileum. Ano naman tawag dyan sa structure above the umbilicus? We call it the, malapit siya sa stomach. So it's called epigastric region. Okay? Epigastric region. And what would we see dito sa epigastric region? We would see here the stomach. As what we mentioned kanina, medyo nasa gitna siya, di ba? The stomach, the pancreas. Diyan natin makikita yung pancreas as well. And ano pa lang, medyo hindi mo lang siya makikita dito sa picture natin. Pero nasa likuran kasi siya. Okay, may pagka-retroperitoneal lang pancreas natin. And very significant dito yung diagnosis when it comes to yung mga GI na doctors. Okay? Kasi halimbawa, they are assessing patients. And yung pain na na-experience ng patient is on the epigastric region. And as what we mentioned kanina, kung nasa epigastric region yung pain, then tentative diagnosis mo na yung dalawang organs na nandyan. So it can be stomach yung nagkakos, so it can be gastritis, or pwede rin pancreas yung nagkakos, so it can also be pancreatitis. That's why mas ginagamit itong division by regions, by 9 regions compared to the 4 quadrants natin. Okay, so again, this is stomach and also the pancreas at the back portion. Okay, ano naman yung nasa ilalim ng umbilical region? We call it the hypogastric. Diba kapag hypo, mababa, hypogastric region. And what structures do we see dito sa hypogastric region? We see parts of the ileum, also the rectum, urinary bladder, can also be seen here. Lagay ko na lang bladder, ha? Urinary bladder, and also sa females, the uterus. Okay, we can see it sa hypogastric region. Okay. Now, ano naman yung dalawang regions beside the umbilical? Beside the umbilical, we call this the lumbar region. Diba? We call that the lumbar area. That's why it's called lumbar region. And lalagyan mo lang siya ng kung saan mo siya makikita. So, pare silang lumbar region, but this is right lumbar. The other is called left lumbar region. And what structures do we find dito sa right lumbar region? We will see there the ascending colon. Sa left lumbar naman, the descending colon. Okay? Then, ano naman yung nasa sides ng epigastric region? So, for the sides nitong epigastric, we call that the hypochondriac region. Bakit hypochondriac? Kasi hypo meaning below, and kapag sinabi natin chondriac or chondrium, it means cartilage. Diba? Kapag merong chondro, C-H-O-N-D-R-O, chondro, it means cartilage. Bakit cartilage? Anong cartilage ba yung makikita dyan? Dyan natin makikita yung costal cartilages. So, dito banda, we have the costal cartilages. Kaya tawag sa kanya is hypochondriac region. And what do we see dito sa ito? Right hypochondriac. Itong right hypochondriac, what do we see there? The liver and also the gallbladder. Liver and the GB or the gallbladder. Dito naman is the left hypochondriac. Itong left hypochondriac naman, what do we see there? We see most of the stomach and also the spleen. Stomach and also the spleen. Okay. Then, we're left with these two. Yung two regions sa gilid ng hypogastric region. This is now what we call the iliac region. And lalagyan mo lang ulit siya ng direction. We have right iliac or left iliac region. Another name for this would also be inguinal region. So it can be right inguinal or also left inguinal region. And what do we see dito sa iliac, right iliac region? We will see here the appendix and also the cecum. Then for the left iliac naman or left inguinal, what do we see here? We see the sigmoid. Most of the sigmoid colon. Okay, then after ng sigmoid, diba, it will go to the midline, going to the rectum, and lastly, to the anal part. Okay?